It's a pleasure once again to meet you all virtually. Now, today I'm going to talk about an interesting thing, which is chronic cough. But here, what is so interesting about chronic cough? I'm going to talk about a chronic cough due to a silent condition known as silent reflux. Now, majority of time, as far as the ENT is concerned, there are only two common causes for chronic cough. One is postnasal drip, and another is acid reflux, or what is known as GERD or GERD. Now, sometimes in most of the patients, they will not have symptoms of any acidity, but they'll be having continuously chronic cough. More so when they are going to talk or when they are going to lie down, or after they lie down and after few hours they get up coughing. Why does this happen? What do you mean by silent reflux? There are so many reasons for reflux which I'm not going to get into in this video, but because of certain actions, the acid is going to come up, and the voice box is a region which is just at the entry of the food pipe. So the acid comes up and irritates the region, and sometimes we can also have what we call it as a micro aspirations, where small, the acid substances gets into the lungs, and the patients keep on coughing. And once a cough comes, then it further irritates the voice box. So now, how do you differentiate between postnasal drip and GERD, or there's a silent reflex cough? It's going to be kind of very difficult for you to make it out, because both of them almost cause the same symptoms. Okay, patients feel something stuck here, patients have cough when they're talking, and patients also have irritation in the throat. So the best thing will be for you to meet with the specialist. But if you seem to be having chronic cough, and one of the things I always tell my patients to do is I ask them to bend their extend their neck like this and talk. When they talk near cough, then you know it's because of your voice box irritation. And the most common cause is going to be silent reflex, and next is going to be the postnasal drip. So that being the case, try to take voice rest. And as long as you don't have an infected reason for your cough, you can do steam inhalation. If you have an infected cough, please do not do steam. Do steam inhalation through your mouth. A lot of patients ask me whether can I do antibacterial gargle. You can, but until it's because of infected cause, it's not going to help you, because it's not going to reach down here. And there are some over the counter medicines which people say I take it, but they're not going to help you. So the best thing will be for you to meet with a specialist. So if you have a chronic cough wherein when you look up you're having cough, that's more because of your voice box irritation, what we call it as laryngitis. And you know one of the common reasons will be because of acid reflux. That's point number one. The other cause will be for people who are going to use the voice a lot, like teachers, or if you're in the IT professional, and if you're in the HR, or if your job needs you to talk a lot, then also it can cause cough because of the chronic irritation of the voice box. Whatever may be the reason, whether it's because of acid reflex, the silent reflex, or because of your voice abuse, all you have to do is look up. This stretching will put a stretch and irritation in your voice box. If that induces a cough, then you know it's because of chronic laryngitis. And one of the common, I'm not saying that's a common thing, is going to be acid reflux, but there are so many other reasons which meeting with a specialist is going to be the best thing. So if you feel it's because of your voice box irritation, then please take voice stress. Do steam inhalation through your mouth. That should help you out. Don't keep on coughing, because that will lead to a lot of other problems like muscle pain. Some patients even causes hernia. Some patients even leads to permanent change in your voice box, leading on to the need for a surgery. So once again, I hope this video was useful. Until next time, thank you.